to give us a speech on using world-class data to deliver a world-class service and what we've learned from the Born in Bradford study here in Bradford. So I'd like to hand over now to Professor John Wright and Dr. Matt Matai.
Well, thanks very much, Catherine. I'm not going to talk much about data, but leave that to my esteemed colleagues following me. But what I want to say today is I'm just so encouraged and privileged to be here with all of you. It's been very clear during the day, just the passion in the room for improving health and life chances for our young people. It's fantastic to have you as educators, as commissioners, managers, the Royal College of Paediatrics, and many others really just wanting to make a difference. And I was taken away by one of the songs that the young people sang this afternoon. The power is in me and it's in you. And I think we do have the power to make change. The Royal College of Paediatrics have just launched a portal on the Royal College site about well-being and health, and it's a portal that you are very welcome to look at and to even join. And the CARE website, Centre for Academic Education Research, also have a link to the WAM portal, and you can make pledges there on behalf of yourself or your organisation, really to try and tackle some of the really wicked problems in child health together. As I said in one of my in a talk on the other stage, 25 years ago when I started as a paediatrician, I thought my role was dealing with sick children, and certainly over the last few years, and particularly over the last 2 years, my understanding of looking after children, even in healthcare, has changed quite dramatically. And one of the key people who changed my perspective on child health was John Wright, who will be speaking after me. And the vision of Born in Bradford really is an integrated healthcare system, a learning system with researchers, quality improvement people, but most importantly, communities and the children that we all are passionate about. So John's going to be talking a little bit about the next stage of the Born in Bradford programme and how we can use data to actually understand our children, our communities better, and how we can look at what is effective in looking after children and why. So over to John Wright.
Anne-Marie Canning has been primed, paid £5 to start the travelling. So welcome to the Climate Emergency Simulation Centre. We're going to keep you here for the next 14 hours and see who wilts the first. It's starting at the back. I'm going to talk about data, starting with Born in Bradford and ending up with Age of Wonder, and a little bit about how we engage young people in this data debate. I was searching for some trainers last week on Google, and it took about 2 hours for adverts for trainers to appear on my Facebook site, on the TNA, all that sort of stuff. You know, it's remarkable the capitalist surveillance state that is around us. So we think of Google and Apple, Facebook, Meta as tech companies, but they are data companies, and they are capitalist data companies. They are selling us things that we don't really want or need, but they're making a lot of money for it. And they're using the data just from our searching. The richness of our data lies in our public records, in our health record, in our education records, in our social care records. They can't get their hands on that. They're finding ways to try and do it, but they can't. But there's a power in them there hills. And that's what I'm going to talk a little bit about now. So for example, could we use this data to find out older people who are at risk of falls, frail older people who need a bit more support that we could target our limited support for? A frailty index, for example. Could we do something with children? For children, for example, who are skipping schools and going to see the GPs for unexplained reasons and missing vaccination points? Could we link all these different sources of data to find a vulnerability index, for example, so that we can target support and prevention to those children who both need it? So the first of those, the frailty index, we've done. We developed it. It was born in Bradford by my fantastic colleague Andy Clegg. The electronic frailty index is now used nationally and internationally. A very simple tool for using routine data to pick out the most frail in our society so we can give them extra support. We haven't done a vulnerability index yet, but my colleague Martin Williams is working hard on it. And he's working so hard and networking so much that he picked up COVID last week. And he was supposed to be doing this talk with me now, but he can't. Well, that's his excuse anyway, so I've got to talk a little bit slower to use up the time. Now, Adam's going to fill in some time at the end. So one of the sort of serendipitous bits, Born in Bradford is a bit of an accidental birth cohort, the unplanned pregnancy cohort, as we called it at the time. And one of the things that we did, we were going to collect DNA, blood samples of DNA and all these fancy biological samples, detailed information about mental and physical health. But one of the things we did in the consent was ask for consent for data linkage for health and education and social care. And for all the amazing, biomedical stuff and research stuff that we've collected, actually the richness of Born in Bradford lies in the routine data. Linking health and education and social care data has just been phenomenal. These silos of information, of wisdom that we just don't connect. So, for example, we collected air pollution data with Sally Jones here. She's on one of the stands. Clean air zone sounds very important. We collected air pollution data from the local authority and we linked it to birth weight from the hospital records. And we showed this really strong association between low birth weight, growth retardation, and air pollution. We did the same with asthma a few years later. That work has now led into Bradford's ambition to be the most ambitious clean air zone in the country. Manchester have bottled it, Leeds have bottled it, Bradford, because of the evidence that we produce in Born in Bradford, showing the harm to our children, has kept firm and is going to build a place of safety for our children. So we're not poisoning them with the particulate matter of nitrous gases churning out of our tailpipes. We did the same with green space. We looked at geographical mapping of green space from the local authority and linked it to the mental health of our mums. I found, again, this really strong correlation. And we've used that to work with Better Start Bradford and the council to think about how we create new green spaces where we most need it, where we can tackle inequality. Really nice example of tackling inequalities. My colleague Kasia Pettinger did some fantastic work linking prematurity and month of birth to educational attainment, linking health and education records. So if you're born in the summer and you're premature, you have this double disadvantage, not just being premature, but being a summer birthday. How many summer birthdays are there here? Yeah, I know it's tough. I'm a midsummer birthday. I blame all my problems on being the last, both the last in the alphabet, but also the smallest and the youngest in the class. But we were able to use that evidence to show the link and then change school entry policy to primary schools across the city. Really nice example as well. And then again, work with Martin Williams has been doing linking educational early years foundation profiles. This is the really fantastic assessments that reception teachers take in primary schools. And we've linked it to health records around autism. Again, showing how highly predictive. So the health service is completely blind to all these children with autism. But the reception teachers, from the data they collected, they know. By linking the two, we've been able to redesign our child and adolescent mental health services to support lead where it's greatest. What a fantastic example. Why would you not share your health and education records? How many people, I know this is a selective audience and I've just warmed you up to the power of linking data, but okay, I'm going to turn that question around. How many people would be willing to share their health and education record for the full public good? Good, yeah. It's amazing when you talk to people, actually. When we're doing a lot of public consultation about Born in Bradford, people either they don't care, they assume that you're doing it anyway, or they're delighted, particularly if you can do it for a good cause. I think that's really important. And trust fundamentally is at the heart of that. And when Central government has tried to do this as they have in the past. Quite often they've failed because we don't trust central government. Sometimes we don't trust local government either, but we trust the place that we live. We trust the NHS generally, that's dropped off a little bit with COVID. And there's a lot of trust in Board in Bradford. And that trust in Board in Bradford we built on showing the power of linked data to take it to the next stage. Can we link data across the whole city? 600,000 people. And my wonderful colleague, Kuldeep Sahal, who's sitting there in the middle, enjoying the reflected glory, not being on the stage, has managed to do that. And she started off. This is stepwise. This is a recipe of how you do it. You talk to people. We set up citizens' juries. We talked to them about the pros and cons, what their concerns were. We built that trust in different communities across the city. We had to cover amazing information governance hurdles to try and get this all done. We had to go through ethics committees to make sure it's all appropriate. The technical aspects of this. Dan Mason sitting next to the reflected glory of Kuldeep. There is a wizard at all the technical side of this, of linking data. It's, this is huge data set, 600,000 people, health, education, social care, environmental data, emergency care. And then you need the analytical capacity to try and work out what's going on in data set. We've started that in Bradford. We probably have the richest data set of anywhere in the country. Not quite Europe, the Scandinavians do this better than us. But it's a remarkable thing. We're now using that data for showing how we can improve older people's care services, emergency care services, and mental health services. And you'll hear a lot more about that because that's a real collective effort from the whole of Bradford. So we are now at this next stage, one of the exciting stages of Board in Bradford, moving from the original 14,000 children to involve every teenager in the city, 30,000 young people. And what a momentous time for these young people. Never has the need been greater. Their schools have been shut. They have been going through unprecedented levels of mental ill health. We've seen that underweight obesity shoot up during the pandemic. There's loneliness, there's self-harm, there's eating disorders. It's a messed up world for these young people. Age of Wonder will be the largest study of adolescents in the world. And we are going to be able to find out, describe their lives. In a place like Bradford, diverse, half our children are South Asian heritage. 70% of our children are from the poorest quintile for England and Wales. So we talk about hard to reach groups. These aren't hard to reach groups. These are the families we interact every day with, but they're not heard. They're overlooked. So we've got a chance to get their voices out into the open, find out what's going on, find out how their lives change during times of recession, which is undoubtedly coming up, during the cost of living crisis, in winter, when they're not going to be able to heat their homes, when they're not going to have enough food on the table. So this is such a critical time for studying and understanding what's going on, but also more importantly, intervening, developing interventions in our city collaboratory of what we can do to tackle that, to tackle inequalities, to improve their health and life chances. Very exciting, and data is really critical for that. So at the moment, we rely on the parental consent for these young people. As they reach 16, they're going to have their own consent. And we're a little bit behind the curve, I think, in terms of the research side of this. They're giving their consent to Facebook, Instagram, TikTok, with the tick of the I agree. And we're still going through some laborious paper exercises of these are the things we're going to do. I'm not sure if we're keeping up to date, nor am I sure that we really understand how our data is being used. And that's everybody, I think. So we have an opportunity. In our last panel that we did, we talked about agency as being one of the key things to address health and education inequalities. Promoting agency in our young people. We have a fantastic opportunity for doing that in Bradford. 30,000 citizen scientists. We're going to be, sequencing their DNA, doing their vitamin D levels. We're going to be feeding this back to them, trying to get them excited about what's shaping their physical and mental health, but also helping them to understand how the data is used, giving them the locus of control about how the data is used. So one of the dreams we've had, we haven't quite been able to do this, I keep nagging down to see if you can speed up the app development of this, but it's the idea of every Born in Bradford participant having full control of the data that we collect, so that they can opt in and out of different studies depending on what they want. Bringing in that sort of consumer bit of actual control of how we use their data. So there may be some studies they don't want to do, but there may be other things that they do want to do. But showing them what we're collecting, sharing that data with them, giving them agency about that data, and then giving them the option of opting in and out. So very exciting. So this is about helping them understand about how the evil multinationals are using their data, but how we can use it for good. How they, as a collective of young people across the city, can do amazing things. This is evidence and science that will change the world, but also hopefully change the city. It's more important for us. And data is at the heart of that. So we've got to start those discussions early. We've got to engage them. How is data being used? What do they want out of it? And give them power. Revolution, folks. And on that note, I will hand over to my revolutionary counterpart, Adam Glazer, who's going to talk about Coral. Is that right? Okay.
Thanks, John. Revolutionary. Look, I'm the only one in this suit. I was almost in on wearing a mask till 2 minutes ago. I've got a tie on. God, but Shaker Bar is not exactly here. You're coming up. Right. I do have some slides, but they've been Bradforded. Mark Moore Williams, and I do really miss him, has doctored my slides. Do you have slides for me? No. Oh, so not only have you tried to edit them, he's chucked them out. So I have a computer, so I know what I meant to say. So I am going to talk about Coral, which is children's health outcomes research and needs. That was what Mark asked me to chat about. But before I do, I just wanted to kind of echo the sentiments of what we've all been saying through the day. The Bradford work is amazing. And Born in Bradford and Connected Bradford is just a stunning example of it. And I think certainly I'm a paediatrician by background, I'm a paediatric oncologist, and the resource that's been made available from the work of John and Mark and the rest of the team here is just phenomenal. And I don't think we can underestimate what they've achieved, and actually the legacy. This is the beginning, I think, for all of us. I'm particularly interested because we are looking to expand, as you might have heard through the day. This is Bradford, we've got Born in Bradford, we've got Connected Bradford, we've got the teenage, and hopefully then the young adult bit that's going to come along with this. But actually we've got to move out of Bradford, we've got to go to West Yorkshire, we've got to go to Yorkshire, we've got to go to the whole of England. And we need to make sure that we learn the lessons that are from this fantastic bit of research. I'm particularly interested in child health, and you might think, oh God, a doctor finding out about health. But actually, you're all doing health. What is health? So the World Health Organization defines health as being a state of complete physical, mental, and social well-being, not anything to do with infirmity or illness. And so actually, every one of you here, whether you're in teaching or social care or policing or a community organization, you're all dealing with health and well-being. And so it's really important. If we can get that right for the youngest members of society, then of course we all know it's a given that there's a knock-on effect for everyone else. So I can't help but kind of reiterate the importance of child health to you all. John, by background, has nothing to do with children in his clinical work, but actually I think he commented on this before many of us. That get it right for children, and you get it right for everyone else. We've heard about the mental health tidal wave of problems that's happening. It was probably starting before this tsunami, before COVID, but COVID has exacerbated it. We just need to look around and walk through our high streets to see the issue with obesity that's coming our way. And we look at it, we know those of us who work with kids, the number of kids who are really large now. It's shocking, and it's very different to what I remember when I was in the playground as a kid. and actually obesity and being overweight predisposes to just so many poor health outcomes in adults. So we've got to get it right for the kids, and we've got to get it right kind of now, a bit like Matt and other people talk about when is the right time to grow a tree. You know, the Chinese poll says 20 years ago, but actually we haven't done it 20 years ago, but we mustn't wait longer than now. So child health is essential, and we need to do it, get it right. So child health outcomes research at Leeds, Coral, if Mark Williams calls it Coral, I think I call it Coral, is a new venture. We're hoping to extend the Bradford bit, as I've said. Many of you may not know this, but part of Board in Bradford is sponsored by the University of Leeds, which is, I'm a representative of the University of Leeds. So I just have to get this in case my paymasters are here. I'm looking around to see if they are. But the University of Leeds, not very far away from here, is really thrilled to be part of this, of course. And over in Leeds, we've got a community of 40 full-time permanent senior academics doing child health research. Mark Williams, who sadly isn't here, is one of us. But you know, we're already quite an established place. At the moment, there are £25 million of active child health grants sitting in Leeds. We've got this opportunity to connect, and we've heard connecting being mentioned so much during the day, but connecting with the broad range of capabilities and capacities that are in the large universities. You know, there's great studies which we can see outside about air quality, but the engineering, getting engineering right, the pollution that John mentioned. Well, these are all the skills and the research that is sitting in the universities, whether it's in Bradford or Leeds or Manchester or wherever. So we've got to start bringing these health issues into the universities and bringing the universities into the kind of laboratory where the children are and where the health problems are. And we think we've got this fantastic opportunity to do that now. On top of that, if you can see my projections, my slides, we have a fantastic opportunity in Leeds. There's a £600 million new children's hospital being built. We've knocked down a very old building, about the same age as the building we're in now, and we're going to have a brand new building. It provides specialist services to children from almost all of Yorkshire, with the exception of South Yorkshire. We go to Sheffield Children's Hospital. So the children of Bradford and surrounds, when they have any very complex issue that needs specialist support, like in my area for cancer, come into Leeds Children's Hospital. So we've got this amazing new build children's hospital, which is a perfect laboratory to study child health and child health outcomes. So it's a brilliant time for us. And it kind of coincides with the investment in the Wolfson Centre for Applied Health and Education Research we've been hearing about. The Wellcome Trust have realised this. They're investing in the N8, which the academics will know as a group of the 8 most research active universities across North England. One of the main themes of the Wellcome N8 initiative is the child of the North. Well, the work that Board in Bradford has done has really made sure that West Yorkshire is right at the heart of this, and it's important that we capitalise upon it and build on that. And on top of that, we've got the West Yorkshire Combined Authority. We've got members of the police here. We need to be really sensible. We've got a fantastic mayor actually now, and we need to make sure this combined authority is building upon the Board in Bradford work and extending it out into the Centre for Health Outcomes Research. But it's not just about having a research centre that does child health outcomes research. We've got to have a workforce. We've got to have people who can do the research. So we've got to train the child health professionals to do academic work well. We can't keep having a divide. It's the same actually in education. It's one thing having teachers. We can't survive without teachers. But we have to have people who understand education, delivering education, and actually research into education as well. And we've got to link everything together. But we've got to train people to do research well. And we're hoping in Coral and your initiative we're going to do that. Of course, the aim, generate transformative new knowledge. We want to support tackling health inequalities we've been all talking about today. We want to promote child health and well-being, and it is all well-being rather than ill health. And we want to, of course, enhance outcomes from episodes of disease that we all look after. So what we will build upon the achievements of Bradford and the existing portfolio of child health research in Leeds, so that we can create a really sustainable, ongoing, world-leading, connected platform of academic excellence that will drive and deliver this whole system approach to enhanced outcomes and enhanced well-being that we all want. So I wanted to kind of flag up Coral. It will build on BIB, and hopefully will be the way forward for all of us, so that we can start seeing a very, very positive future for our children and grandchildren. So, and thank you so much for your amazing work here. It is just amazing, and thank you.
you. That was Adam, John and Matt there. I'd like to welcome back to the stage Anne-Marie Canning to tell us why supporting our pledge today is really important. Anne-Marie.
Hi folks, I'm not going to speak for very long. First of all, I just want to say thank you so much for making it to the end of this conference. It's been incredibly hot and you've been so good-natured. Thank you for all your questions, ideas and all the brilliant conversations that have been had today. So I've got one last request for you before you depart, and that is to sign the pledge to support the Alliance for Life Chances, either as an individual or as an organisation. The Alliance for Life Chances is a proven approach to tackling opportunities for young people and children. It was initially this methodology piloted in Harlem, in the Children's Zone. It's happened also in Oregon. It's happened also here in the UK in Felton. And the next place it needs to happen is Bradford, because if there's one thing we've learned today, it's that working together means we can achieve more for children. So please do sign up. And there's another reason I think you should sign up. More than any conference I've ever been to over the past 15, 20 years, however long I've been working, everyone seemingly on panels today has said this phrase, not to be political, but. Well, the next bit of your sentence needs to be, not to be political, but I'm supporting the Alliance for Life Chances. Because like I said in my opening speech, when politics is weak, civil society must be strong, and you should all be considering yourselves leaders on behalf of the young people at Bradford. Now, I hope you'll just give me 30 seconds to say some thank yous. It would be very ungracious for us to depart without saying some thank yous. First of all, I want to say a huge thank you to the organisations who supported today. That is the Centre for Applied Educational Research, it is PricewaterhouseCoopers, and the Bradford Opportunity Area via the DFE. I'd also like to thank all the staff here at the Salts Mill who've laid on a fantastic venue and been so generous in hosting us, and also to Lobna who's been working on all of the details to make today really sing. I also just want to take a few seconds to thank the civil servant team behind the Opportunity Area. Civil servants don't always get an easy rap, but we have been so lucky to have a fantastic team behind us here at the Bradford Opportunity Area. I particularly want to say thank you to Matt and to Lee, who've been stalwarts over the years, not just today, but over the past 5 years. I also want to say thank you to 2 board members in particular who have put their heart and soul into today's conference. Chris Bunting, there he is, stood up, has put so much time and energy into getting lots of people here and such a dynamic event put together. And also to Mark Munn-Williams, who you've heard lots about already, but really is a force of nature. And then finally, before I hand over to her, I want to say thank you to Catherine, who's been our programme director at the Opportunity Area. We have been so lucky to have you for the past 5 years, and so lucky to be having you leading us into the Alliance for Life Chances. So thank you, Catherine. And finally, thank you to all of you. Last remark goes to Catherine, over to you.
Thank you, Anne-Marie. And I promise you, last phase today, this is it now. So I know you want to be rustling in your bags, getting your train ticket out, getting your keys, but before you do, I want to give you all something. It's not a physical thing, you've got your coffee cup. It's actually praise, and who doesn't like praise? Because today, actually, what we've realised is we're creating something meaningful for the next generation of young people. And I think you should be very, very proud of yourselves that with coming today, it has made a difference. It's shown that we're committed to making a difference to the lives of young people here in Bradford. Yes, our place is unique. It has its challenges, but it's got a wealth of opportunity. And on that wave, we ride high. What a day and what a turnout. I hope you've personally seen or heard something that's inspired you to get involved, to support our collective cause in tackling inequalities. Remember, our alliance is nothing without its coalition of support, and for that, we need you. I want to say a huge thank you to all our panel members, our guest speakers this morning, because without you, it wouldn't have happened. And of course, a very special thank you to all those wonderful ladies in orange t-shirts who have been fantastic behind the scene helpers yesterday and today. So thank you so much. You've been a credit to yourselves. So just a couple of things. Just make sure if you want a bit of bedtime reading, look in your packs. You've got some hearty bedtime reading there, snacks to go at. Please do reuse your coffee cup. Take them from meeting to meeting, because you know what? In here, in Yorkshire, working together starts with a good brew. Thank you all for coming to Salts Mill here in Saltaire, being part of the day, safe onwards journey. Thanks everyone.